All right, so we've got a client here. She's had a history of ankle sprain and hurt her ankle on the outside part of her feet. 3 years ago, hasn't really trained it. It's sort of hurting her around here. And so she's coming in, we're gonna have a look at how she's moving and do some tests from there on in. Alrighty, looking at the squats now, we can see as she goes down, more of her weight is shifting to the left side of her body compared to the right. She's also got externally rotated right foot compared to the left, and she's got flatter feet on the right. And more on the side on angle, you can see that her heels are starting to lift at an earlier point, which might suggest some ankle stiffness, and overall suggesting there are some hip and ankle mobility issues that need some addressing. All right, so we're just gonna have a look at her ankle mobility now. So we're just gonna do a knee to wall test. So let's do your left one first, the good side. So let's start at this black line. Perfect. Moving back to the next black line. Yeah, that's probably the limit there. Say about 15 centimeters, and then you're right now. Yeah, so that's starting to lift there. So that's about 9.5 there. So clear difference there in your ankle mobility. So now we're going to be looking at some single leg calf raises to assess the strength of her calves on one side compared to the other. So just doing some calf raises. Good, so we're just looking at the height here between the ground and how far she gets up. We're looking at the quality of the movement, how controlled it is on the way down as well, and then that's what we're going to be comparing to the other side as well. Okay, so we look onto the weaker side now. So as you can see here, she doesn't really want to push off the big toe here, which could suggest that there's some tib post weakness for her. She's also not getting as high off the ground as well, suggesting some strength deficit into her right calf compared to her left. All right, so now we're going to look at her single leg balance. So she's going to get up on the one leg, try and balance that. And essentially what we're looking for here is seeing how she's using her ankle to balance herself onto the Bosu ball. And then we'll compare that to the other side and see how she's going with that. Yep, and then we'll swap over. Yeah, you can sort of see it's working a lot harder to try and keep her a little bit more balanced, but that could suggest that there's some proprioception missing in her right foot compared to her left. So balance might be some of the things we need to work on with this client. So whenever we're looking at someone with an ankle or a knee problem, we also have to assess their hips. So I've already done her range of motion and strength tests, but one of the things that was really interesting is her hip abduction strength. So I'll show you what that looks like from her good side here. So I'll get her to lift her leg, and then you're just resisting me. Don't let me push you down, don't let me push you down. Good. Pretty strong on this side, so we'll compare to the other side now. Good. Lifting this leg up here. Don't let me push you down, don't let me push you down. Good. So you can see this one sort of has a bit more give, easily pushed down, suggesting some weakness potentially through the hip abduction here. Okay, so one of the exercises that I would give to this client here is going to be a calf raise with a ball squeeze here. So I'll show you what that looks like. So we'll place the ball here in between their two heels. The client will now squeeze this ball here between the legs, and now they're going to do their calf raises. So what this is doing is promoting the client to use their big toe here while they're going up and sort of helping them get the proper range of motion through the whole forefoot. Perfect, and we'll do maybe 10 reps of that until they've got maintained a good form. We don't want to lose posture for the sake of doing increased reps. To address the balance deficits for this client here, one of the simple exercises that we can do is pretty much in the morning when they have a brushing routine, is whenever you're brushing, you just go onto one leg. So pretty much single leg balance while you're brushing. You can look at yourself in the mirror while you're doing this, but making sure that the other leg is not touching the one that's on the ground. So to address this client's hip abduction weakness, one of the exercises we could do is a side plank. This is really good because it engages the whole body and the core as well. So you can start out with the legs all out in front in a straight extended position, but if that's too hard, then we can modify it and bend the knees to 90 degrees, getting them up and into that position into a side plank. This is really good. Hold that for about 45 seconds to a minute and then repeat. Okay, so we've done our palpation now, and we've found that for her, the ATFL, some of the perineals and calf is quite tight and tender, so that might suggest there's some oversensitivity in this area, so we'll be manually working through these areas. Okay, so what we're doing here is working on her ATFL with some friction, so we're just spending some time here on the ligament, helping that desensitize. That will give her some pain relief, and then we can work on her calves with some massage, and this will help her improve with her knee to wall as well. Okay, so now we've done all our treatment, we're going to reassess her knee to wall. So we're going to come down here, we're going to start at the close line here, and then work our way down. Great, so she can do that easily. We're going to move back down. Let's start over this one here. Perfect, move back into this line here. Okay, so that's starting to probably just lift a little bit, but as we can see, she's at 12 centimeters now compared to the 9 she was at before, so clearly an improvement on her part.